So let's talk about ovarian stimulation strategies for intrauterine insemination. And this is a systematic review. So just have a look at this paper. And this explores a study on different strategies of ovarian stimulation. And it's a systematic review with an individual participant data meta-analysis. And what it looks at, looking at safety of gonadotropins and effectiveness, letrozole, and clomiphene citrate. So we do know that intrauterine insemination is a treatment for unexplained infertility. And what is unexplained infertility? Again, it is an infertility that is we have not been able to achieve after a year of trying. Intrauterine insemination is where you deposit sperm after a wash sample right into the uterus, and ovarian stimulation is often used in conjunction with IUI so that you increase the number of oocytes, and this can further increase the chance of conception. So what are we looking at? We're looking at gonadotropins, and these are hormones that stimulate the ovaries, mainly FSH. Letrozole, again, is a medication that belongs to a class of drugs called the aromatase inhibitors. It works by blocking the production of estrogen. That gives rise to FSH and is used to stimulate the ovaries, while clomiphene is an oral medication that stimulates the ovaries by blocking the estrogen receptors in the brain, and this leads to an increase of FSH and LH production. And remember, it leads to an increase of FSH and LH, different to letrozole, which stimulates the ovaries to produce eggs. Now, if you have a look at the next slide, what is the study methodology? And it was employed by an individual participant data analysis, which is considered to be a gold standard. And what did it then say? So if you look at the live birth rates from all these studies, you're looking at gonadotropins giving the highest live birth rate, clomiphene citrate giving 22%, and letrozole giving a 19%. So while there was no doubt that gonadotropins showed a higher chance of pregnancy, they also represented an increase in multiple pregnancy rates. So if you have a look at this, the multiple pregnancy rates were significantly better. Now, time to conception, again, what was better? In time to conception, gonadotropins experienced a shorter time to conception compared to letrozole and clomiphene. So what is it telling us? It's telling us, one, that gonadotropins give you a faster route to pregnancy. They tend to have a higher success rate. They tend to have a slightly higher rate of twins. If you looked at the other outcomes, the ongoing clinical pregnancy rates of gonadotropins were higher compared to clomiphene and letrozole. Miscarriage rates, there was no significant difference in miscarriage rates were observed in gonadotropins or clomiphene. However, there was a slightly higher chance of miscarriage compared to with gonadotropins to letrozole. And this has been seen by earlier studies too, where letrozole seemed to give a lower chance of miscarriage. Again, cancellation rates, you're looking at gonadotropins resulting in a much higher cancellation rate compared to letrozole, but there's no significant difference between gonadotropins and clomiphene or between letrozole and clomiphene. So if you look at covariate interactions, again, they explored the potential interactions between treatment effectiveness, such as BMI, age, and primary secondary infertility, and they did not find much of a change. So what are the strengths of this study? If you looked at it, that the use of the IPDMA allowed a robust analysis and increased the reliability of findings. And that's the harmonization of eligibility criteria, certainly much better, and an in-depth analysis out as the positives. Limitations, again, there's a limited IPD access, and at the end there is certainly a certain amount of missing data that comes in. What are the clinical applications? And when you look at the clinical implications, we're looking at gonadotropins are more effective when you do intrauterine insemination due to increased risk of multiple pregnancies. Starting on a lower dose, much better, because that would give you lower the chance of multiple pregnancies and keep on to the high birth rate. And the role of letrozole needs further investigation. And what we do know is that for polycystic ovarian syndrome, letrozole is far better, and there's no doubt about it. But for unexplained, it seems that clomiphene and gonadotropins do better than letrozole in intrauterine insemination cycle, and that is something which is still not very well understood. And again, you have to make a understanding on the choice of stimulation, on effectiveness, safety, cost, and availability, and equally the patient's preferences. So that's in short about a paper review. So what I've done is I've got about 20 paper reviews to be done, and I'm going to do these probably in every 2 or 3 weeks. So if you have any questions, pop it on fertilitycourses@gmail.com, and that's what